Hi guys, my topic is maternal malnutrition around the globe. So I will first give a brief introduction about the concept, why this is a global issue, and then share a part of my research about the social determinants and regional factors that affect the maternal malnutrition. First, let me give a quick self-introduction. I'm a rising senior in Shanghai, China, and I have volunteered in China Food Bank, giving some lectures about food security issue and initiated a food donation campaign. I would also like to explore a career in food science and food security. I have conducted a research on fat diets so far and created a series of blogs. And I'm also doing research on water quality and maternal health. So first, what is maternal malnutrition? In order to ensure the safety of the babies and the health of the women, they need a lot of nutrients, a wide variety of different micronutrients at every stage of pregnancy, both before, during, and even after. Meeting them is really critical for women's health and impacts children's development before 5 years old. Maternal malnutrition is not only about low energy intake, but also includes low dietary diversification, which could probably result in iron deficiency and micronutrient deficiency. Obesity is also a kind of malnutrition. Why this is a global issue? This is because as many as 1.2 billion girls and women are malnourished, and iron deficiency alone is affecting up to 52% of pregnant women. The multiple social crises that are affecting the world is also increasing the number of pregnant and breeding mothers who are suffering from acute malnutrition. In fact, they have increased to 6.9 million in 12 most affected countries. And then let's have a brief overview about maternal malnourishment around the globe. Africa is the continent that has suffered most from this issue because as many as 23% of mothers are malnourished. In South America, 70% of children under 5 years old are stunted, and the development at this stage is closely related with maternal health. As in South Asia, eating dysregulation during pregnancy, which is a part of religious belief, leads to thin fat phenotype among the newborns, who are featured with big belly and thin extremities. Even in some of the most developed regions in the world, the rise of fast food culture could increase the likelihood of low dietary diversity and obesity. Besides these regional factors that determine the maternal health, there are also universal social determinants. For example, rural residency. Mothers living in urban areas are less susceptible to malnourished because they have better household, better access to markets, and wider food choice. Pregnant mothers with low education attainment are also more likely to be malnourished because they don't have as many as awareness to supplement themselves with sufficient nutrients during pregnancy. Mothers with better economic status are 53% less likely to be malnourished because they can afford better food and more organic food. Multiple pregnancies also increase the likelihood of malnourished by 215% because the mother is not recovered from previous pregnancy, and carrying a baby while she is still pregnant is an extra burden to herself. However, still a lot of people generalize maternal malnourishment and understate it as something as mothers and children's issue. However, the truth is maternal malnourishment is affecting the economy and the whole globe. As for physiological effects, mothers are suffering from anemia, which is a lack of blood cell, preeclampsia, a type of hypertension, and even death. For children, they can die in their mother's womb, called stillbirth, and suffering from low birth weight, wasting, means that a part of their body is physically weaker and developmental delays. Over 1 million infants deaths and over 6 million children are underweight because of maternal and child undernutrition. Maternal malnourishment also affects individuals who don't have babies, because the poor nutrition will hamper the mother's ability to learn, earn, and thrive, and thus pull the whole family into the vicious cycle of undernutrition, deprivation, and poverty, and also lead to decreased productivity in a part of the people in the country. In Cambodia alone, the maternal malnourishment and suboptimal breastfeeding would result in a $36.9 million economic burden. And we also considered long-term impacts, such as securing fees about developmental delays and wasting. The whole economic loss will amount up to $266 million. Despite the situation that maternal malnourishment is affecting every individual in the society and the future generations of the globe, social stigma is preventing women from seeking help from the others. Pregnancy has long been viewed as women's issues, and pregnant women are also viewed as uncommitted. Social stigma also hampers the support for adolescent pregnancy and mothers with substance use disorders, which are the two groups that need specific help. All these social stigma combined results in the fact that 25% of expectant mothers are not willing to share their pregnancy news. And there will only be more mothers who are not willing to share the feelings and symptoms during pregnancy, and based on which others may find out that they are suffering from malnourishment. Without this kind of social support, pregnant mothers are more likely to lead an unhealthy lifestyle, and stigma is also a social barrier to treatment for malnourished kids. In conclusion, maternal nutrition is a global issue, and it is also affecting the economy, the future generations, and solving it is not only in the field of physiology, but also in the field of solving these social issues and solving these regional factors. The thing we could do right now is to break the social stigma. Individually, we can work with the local movement to support the pregnant mothers and donate for organizations. And we can also advocate for governmental support, design intervention program, and build supportive community. These are my citations, and I would like to thank GHLC for giving me the chance to share my research, and my friends for supporting me. And most important of all, thank you all for listening.